Hi everybody, today we're going to talk about trigger point injections. This is something you can do in the office pretty easily, and I think it's a good way to get pain relief for your patients. So let's get into it. Alright, so what is a trigger point? It's a discrete focal hyper-irritable spot that's located in a band of skeletal muscle. They produce pain locally in a referred pattern and often accompany chronic MSK disorders. I'll let you read through the rest of this, but those are the main things that you need to know. So the big thing with the trigger point is you have to be able to palpate it. So you're going to feel this bundle of fiber, kind of feels like a knot, under the skin is the best way that I could describe it. It's obviously harder than normal consistency. And when you push on that area, you're going to have the patient let you know that they're feeling pain over that area and or that the pain will radiate potentially. And trigger point injections have been shown to be one of the most effective treatment modalities to inactivate that point. I've had patients that I've done OMT before trying to get those areas to relax, and I haven't been able to get it with OMT, and then I do a trigger point injection and it's gone, and I, basically essentially wasted their time doing 2 OMT sessions when I could have done that in the first place. So definitely something to consider. You guys also might have heard of the term tender points, which is definitely different than a trigger point. So here is the difference between them, and this is from AFP. And equipment that you'll need for a trigger point injection. Again, as we talked about in the knee and shoulder lab, you will want your MA to draw this up for you and want to discuss the procedure with your preceptor before the MA draws up that solution and gets your equipment ready. So you're going to need gloves, gauze, alcohol pad, just a 3 ml syringe is fine. Lidocaine, just a small amount. You do not need a lot of lidocaine. And then your needle length will actually depend on where you're going to inject in the patient's body fat percentile, and then a Band-Aid. Okay, contraindications to trigger point injections. They are on, a ton of warfarin. They have a horrible bleeding disorder, although realistically, this is a tiny little injection. You shouldn't be causing a ton of bleeding while you're doing this. For me, aspirin ingestion within 3 days of injection is not a contraindication. But again, something to think about: aspirin, warfarin, those sorts of things on any patient that you're doing any procedure on, and then weigh the risks and benefits. Obviously, if they have a systemic or local infection in the area, they are allergic to lidocaine, extreme fear of needles, again, then you probably won't be getting vaccines either, unfortunately. So there really is not a true contraindication to trigger points other than, in my opinion, the systemic infection or allergies. Complications. Luckily, I have never seen either of these happen, and hopefully we never see any of these in our clinic. I've had people pass out from vaccines, but not from a trigger point. I haven't, luckily, had an infection from one. I have not dropped a lung at any point in my life doing anything, and I hope to continue that. Needle breakage, haven't done that either, and hematoma formation. And just a couple of figures that are also from AFP: frequent locations, and then examples of directions where that pain may refer. So we talked a little bit in earlier slides about needle selection, and that really depends on the patient. But typically your 22 1.5-inch needle is usually fine. So I would stick with that 98% of the time, and you should be fine. Injection solutions, you're going to use 1% lidocaine. Some other specialists, doctors, myself in the past, kind of depends on the evidence, will put steroids in with that lidocaine to do a trigger point injection, but they found recently that that's not the best thing to do. So nowadays we're really just using lidocaine to inject into that area, but you might hear people using steroids, so I wanted to mention them. Injection technique, obviously you want this to be sterile, and you don't actually want to insert the needle directly into the trigger point. You want to insert it about 1 centimeter or 2 away at a 30-degree angle, and then you advance it into the trigger point. So you'll see some videos on YouTube if you go looking for them before you do the procedure, which realistically you should, and they don't do that, and that is incorrect. So make sure that you're not sticking the needle directly into that trigger point. And then with any injection, you want to withdraw to make sure that you're not within a blood vessel. And then here they mention, you're just using 0.2 mLs. I mean, very, very small amount here that you're using. You're not injecting 3 mLs of lidocaine into this tiny little spot on the patient's, trapezius muscle. And then you want to move that needle around a little bit too. So you want to withdraw once you're into that trigger point, and then kind of a 3 to 4 point radius around there. And you put just a little bit more lidocaine in each of those areas. And I have a couple pictures for you here. So this is, also from AFP. I'm sure you guys are familiar with their pictures by now, but it shows them going in this last slide at the 30-degree angle, and you're going to go hit that trigger point. And then here's another example. And you want to make sure you don't stick yourself, but you want to have your fingers outlined that trigger point area. So this would be just, warning, please do not stick yourself with a needle while you're doing this. And then post-injection management. So you're not supposed to inject this multiple times if you've been unsuccessful in the past. Obviously, if it doesn't work, then we probably need to think of something else to do instead of doing the same thing over and over again. Band-Aid, again, is adequate. And stretching the muscle after has been shown to help. Occasionally you'll have some soreness, but that should not be too troublesome for the patient. And that is our trigger point lecture. Again, with any procedure, I would encourage you guys to look into this before you actually do one. Come to clinic prepared to explain to your preceptor, watch some videos online, and hopefully we'll get to do some procedures with you guys in the office soon.